All right, 5:26 this morning. Welcome back. Some popular and pricey GLP-1 weight loss drugs will now cost much less for older Americans. Medicare is now offering drugs like Foundayo, Wegovy, and Zepbound for a $50 price a month. Qualifying beneficiaries will have to meet certain weight and health requirements like a body mass index of 35 or higher or 27 or up with another health condition like a prior heart attack or stroke. Now, this deal is part of a pilot program set to expire at the end of next year.
So seniors could end up taking these drugs for 18 months and then could lose coverage overnight. And what we've seen in studies is that most people who stop taking these drugs, about 2/3 of them, regain the weight after stopping.
And for continued coverage, Congress would have to authorize Medicare to permanently cover the drugs. The Trump administration says it plans to carefully track participation and outcomes. Well, it is one of the most common neurological conditions among young adults. Multiple sclerosis can impact mobility, mood, even cognition. Millie Gaither explains how researchers say a change in the way multiple sclerosis is diagnosed is allowing cases to be caught earlier.
There's no specific test that can diagnose multiple sclerosis. Instead, doctors use what's called the McDonald Criteria, a set of guidelines that can help rule out or confirm the disease.
So multiple sclerosis is a condition that is very treatable.
Dr. Daniel Antoneda with Cleveland Clinic says there are more than 24 approved medications that can help control multiple sclerosis symptoms and limit disabilities. But he says the disease starts years before the first attack, and the earlier patients start these treatments, the better they respond.
One of the things that we have to focus on is making sure that we get the diagnosis done early and accurately.
In an effort to do that, the McDonald Criteria was updated in 2024, allowing doctors to give an MS diagnosis by using MS-specific biomarkers and MRIs to find early evidence of the disease.
We can be pretty confident that a person has MS, even if they haven't yet developed classical or typical symptoms of multiple sclerosis.
In this study, Antoneda and others found about 1 in 5 people they studied in the U.S. who wouldn't have met criteria for MS with the old guidelines were able to be diagnosed accurately and early under the updated criteria, allowing for treatment sooner.
It completely changes the panorama of what that individual's life will look like.
For Health Minute, I'm Mandy Gaither.